Welkom terug. Die Suid-Afrikaanse Gesondheidsproduktebeheerraad, oftewel SAHPRA, het besluit om die program vir deernisbehandeling van COVID-19 met Ivermectin te beëindig. Die program is vir hierdie jaar in werking gestel nadat SAHPRA 'n ooreenkoms aangegaan het met die partye wat hof toe is om die gebruik van Ivermectin vir COVID-19 toe te laat. Die ooreenkoms is toe 'n hofbevel gemaak. Ivermectin is 'n teenparasitiese middel en vir hierdie jaar was daar groot omstredenheid oor die gebruik daarvan in die behandeling van COVID-19. Fokus se uitvoerende regisseur Alet van Rensburg het SAHPRA se uitvoerende hoof Dr. Boitumelo Semete-Makokotlela gevra waarom hulle besluit het om die program te staak.
The reasons for SAHPRA terminating this program was that, unlike when we instituted this program, we're now certain that we don't have the situation of a clinical equipoise anymore, which means that we've got data that indicates that the drug does not have clinical benefit for the management of COVID. And therefore, that's the reason why we are terminating this program.
But it seems that a lot of experts all over the world are still disagreeing about this. It's very confusing for us as, members of the public. We don't understand all of this.
No, thank you. So, we've looked at data generated in many countries across the world. We've looked at data from Malaysia, data from the UK, from Israel. And what you note is that all regulators, pretty much most regulators and the credible regulators across the world, we're all on the same page. The US FDA, as well as the WHO, in terms of the lack of clinical benefit. But also locally, we have the National Essential Medicines List Committee that has similarly reviewed data and has come to the same conclusion.
Now, when you allowed the compassionate use of ivermectin for the treatment of COVID-19, that followed a court case where several people went to court and you came to an agreement, and then that agreement was made a court order. The fact that you're now retracting this, doesn't it mean that you are actually in contempt of court?
No, certainly not, and we would need to make sure that we're not. So we have checked with our legal team, and the one thing that was very clear in the court order was that SAHPRA will continuously monitor any scientific data that is generated and amend its decision whichever way, and amend its decision adequately. So our legal team has looked at all of this, and we're not in contempt at all.
Well, this medicine has been around for 40 years, mainly for the treatment of parasites, and we know for river blindness it was used very successfully. It's also been described as one of the safest medicines in the world. Some people have said now, before COVID, they used to describe it as even safer as aspirin. Has there been any serious cases where there's been side effects or people got sick from ivermectin?
So maybe what I could also do is just to explain that usually when you determine the safety of a product, you also have to look at the dose that has been administered. And we have received reports from some of the doctors who were utilizing that they saw some damage to the liver caused by ivermectin. And so while these indeed were isolated reports, we didn't get, to those that we had authorized, we didn't get as much reporting as we had anticipated. So safety very much linked to the doses that are being administered.
The one thing that I've heard from doctors who are pro-ivermectin is that they say these reports about liver failure, the question there is, were those patients also treated with remdesivir? Because they say that is the one medication that could actually cause that.
Yes, and so... Yeah, so we haven't seen that specifically in the reports that we have received. And as I say, it's unfortunate that we didn't receive as many reports to those that we had authorized under this program as we would have liked. So it's very difficult for us to conclude on that. But based on the studies that are published, we haven't indeed seen some of those cases, but we haven't had those reports for us here in South Africa.
Don't you think by actually making it difficult for doctors now to prescribe or impossible to prescribe ivermectin for COVID-19, that there's a danger that a lot of people are going to revert once again to the veterinarian form of ivermectin, and that's not ideal?
Not quite. I mean, we have been monitoring the applications since we implemented this program. And I must say, for the last 6 months, even with the previous wave that we had, we didn't see an increase in the number of applications. Even now, even as much as we're still determining are we in the 5th wave or not, depending on the definitions being utilized, we're not seeing an increase. So it looks like really doctors are either not seeing the expected clinical benefit or that they are no longer prescribing it. So, we're not seeing that. But also from the use of the veterinary, we will continuously monitor that together with, industry that is availing it for the veterinary sector.
A very last question. What does this actually mean? Does this decision by SAHPRA now means that doctors cannot get it and that South African pharmaceutical companies can't actually make ivermectin at the moment, or what does it mean?
Sure. So what this decision means is that under this this program no longer exists, right? So we can then not make the specific formulations of ivermectin available for management of COVID. We do, however, have a topical formulation of ivermectin that's being authorized. Now, what that means is that those pharmacies that are compounding this product on a prescription basis for a specific patient, specific quantities for specific timeframes, the doctor can then write a prescription and then the patient can get it through that mechanism. But then the responsibility fully lies on the doctor to manage that patient and to ensure that the patient is kept safe, because we would then have not authorized it for COVID management. So it's squarely on the doctor.
Bly ingeskakel, net hierna stel ons jou voor aan 'n man met 'n interessante motor. Ons is nou